Yes, from Olamiju. Yes, we're on TikTok too. So Nigeria Info is Nigeria Info everywhere. 99.3. Okay. Now, Lagos. Today's conversation is driven by a troubling. Yes, encapsulator. I'm not trying to sound like it's a sensationalism kind of conversation. Okay, so I'm not trying to be sensational here, but this is what the conversation is about. Okay, this conversation is based on or let me say, driven, yes, by a troubling global reality. And I must tell you before I introduce my guest, okay? Now, that conversation is Nigeria still leads in under 5 deaths. Can SARMAAN change the story? Yes, I'll tell you what SARMAAN stands for. It's safety and antimicrobial resistance of mass administration of azithromycin in Nigeria. That's SARMAAN. You'll be hearing a lot of that on the show today. I'll repeat, okay? Now, so there is a latest current United Nations statistics on child mortality in Nigeria. And that statistics shows that Nigeria still leads. LEADS. Yes, leads in maternal mortality. Now, the title of that report is Levels and Trends in Child Mortality. And the report was released on the website of United Nations in March 2026. Remember, about 2 years ago, yes, in May, we had essay to President Tinubu on the show. That's Dr. Salman Onos Ibrahim on the show, and then we unpacked a lot. So today we're having solution discussion. We're not here to highlight the issue, the problem, or the challenges. Now, how can we profile solution is this conversation we're having. And right after this commercial break, I'm about to observe my guest, Dr. Francisca, will be joining me on the show. She's joining us by Zoom. Okay, Dr. Francisca Olamiju, Executive Director, Mitosath, SARMAAN Implementing Partner in Bauchi State. So Lagos, don't go anywhere. We'll be right back. I would love to get your thoughts on this conversation, because today I don't want to talk to myself. I want to talk with you, even though my guest is live with me on the show. Please don't go anywhere. We'll be right back.
Free Nigeria Info. We'll be right back.
Football experience is back. It's Goal Fest 2026, the 10th anniversary edition. Join thousands of fans for the ultimate football party. Big screen action, live DJs and a hype man, games, food, and non-stop football vibes. And of course, live performances by some of Nigeria's biggest superstars. Fest is happening Saturday, May 30th, 2026 at the Balmoral Convention Center, Victoria Island, Lagos at 2 p.m. Register now at www.goalfestnigeria.com. Come and experience football like never before. Goalfest 10th anniversary, sponsored by Squadron, Doc Rum, supported by Indomie, proudly refreshed by Pepsi.
Let me tell you the real thing to brag about. Brag about how authentic you are. Brag about your confidence and your vibe. Brag about your style, your energy. And yes, brag about how amazing you smell. Because there one fragrance that gives you all of that in one bottle. Wazobia perfume.
Oh yes, Wazobia perfume. The same perfume everybody's talking about. See, once you step in with Wazobia perfume, you don't need to talk too much. The fragrance does the talking for you. Be authentic, be confident, be classy. Treat yourself and your friends to Wazobia perfume today. Available as both perfume and body spray.
Get your Wazobia perfume today at any store near you or order online for carton purchases or to stock Wazobia perfume. Please call 0201-330-0047 or email contact@wazobiacosmetics.ng. Wazobia perfume, the correct scent.
Stay updated and stay locked.
Are we not seeing it like it's a thing that has been planted and is growing fruitfully?
We talk about justice. Can we get justice in Nigeria as it is?
Struggle to understand whether we are
When a lot of people are saying that government have hands in this insecurity in Nigeria.
Die on a daily basis. Enough is enough. We must put an end to it.
We know that in Nigeria government, the law was made by the rich for the poor to obey.
It wasn't as worse as this, and I came to church with my suit and tie. I carried placard from church. We marched the streets of Lagos.
A number of men on maternity line talking about how their partners have been behaving after childbirth.
It would have been better if the president did not even visit at all.
And take it to the National Assembly. Because if they can sleep at night, not worried about whatever it is that we are going through.
The conversation continues right here on 99.3 Nigeria Info. Let's talk.
All right, Lagos, welcome back to Maternity Line Show with me, myself, and I, if there is anything like that. I am Zaynab Yekeen. Yes, and every Friday you get to hear my voice on this platform, even though my name has been mentioned on the crossfire in the mornings, okay? So, today, I have been trying to connect my guest via Zoom. I'm trying to figure out what's going on right now. But while at State Lagos, I'd love to engage you on this one, okay? Earlier, before that break, I did tell you that there is a new United Nations report, and I also mentioned title of the report, which says Nigeria still leads in high maternal mortality. Okay, in as of 2024, anyway, according to that report. And I still remember in 2024 there was a discussion we had with Esito, the president in Obu. Then we were talking about a similar statistics, a similar research by UN and other partner groups, pointing to the fact that Nigeria at the time led, in this regard. And then we are looking at solutions. Why is this repeating itself? What is working and what is not working? What exactly is going wrong? And then we have a community approach that we will be talking about on the show today. Please stay here. I'll be right back. Don't go anywhere.
This is The Voice Note. The Voice Note. On 99.3 Nigeria Info. Let's talk.
The tragedy of Nigeria began in 1986 when we did the structural adjustment program. When we were persuaded to devalue our currency every week for 32 years. When I went to school, and many of you are here, the Naira was $1.50. The Naira was almost £1 sterling. They came here, persuaded some brilliant men from Harvard and the World Bank that weekly devaluation was wonderful. 32 years of devaluing your currency until we hit 527. And they were still telling us that the Naira was still overvalued. That brought poverty, misery upon us. Because every time you bring in a shipload of rice, you also bring in a shipload of unemployment. because you are transferring your wealth to sustain other economies. Somehow, Nigerians didn't notice it. So we became a nation of importers. Import, milk, sugar, toothpicks, toothpaste, handkerchiefs, pencils, we don't make. Let nobody take it lightly. These guys have seized this country's economy, they've taken us hostage, and they have no intention of giving up. Because this is a huge market, a very sweet market.
This is
Maternity Line.
Maternity Line.
Hey Lagos, it's my absolute pleasure to announce to you that I now have Dr. Francisca Olamiju, Executive Director, Mitosath. I hope, is it Mitosath or Mitosath, Doctor? She's going to be telling me that. Mitosath, SARMAAN implementing partner in Bauchi State. SARMAAN again is a safety and antimicrobial resistance of mass administration of azithromycin in Nigeria project. Okay, now she joins me live on Maternity Line Show. Good afternoon, Dr. Olamiju. Great to have you join us on Maternity Line. Okay, so doctor, before you came in, I was telling Lagos about the latest reports by the United Nations, and I understand that over the years, Nigeria has implemented several interventions, you know, from immunization programs to primary healthcare reforms, and even recent efforts under the current administration to strengthen child survival strategies. But it's still heartbreaking to know that Nigeria still leads in high maternal mortality as of 2024-2025. Doctor, what exactly is going on? Now, the question is, Nigeria, you know, leading, we know how sad can be, you know, at the global level in under 5 deaths. What in your own view, doctor, is the single biggest reason this crisis persists despite multiple interventions over the years?
Thank you very much, and welcome to this session on SARMAAN and our intervention. I think it's really, when you talk about past years, it looks like it's far, but the UN report as soon as in March 2026 shows that we are still having close to 110 thereabouts death out of 1,000 live births. So it's not something that we're excited about.
We're not.
Because that shows that if we have 1,000 children giving birth to, before they get to age 5, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, I'm still counting 11, up to 110 or more would die. So for us, it's something that we need to do more for, to make sure that is addressed. And I think the greatest challenge we have is our socioeconomic life in Nigeria, and there's disparity between the rich and the poor. Of course, you know that that's the number of children that we lose due to mortality.
Right.
It's not the same among the rich and the poor. So we have sociocultural issues, we have socioeconomic challenges, we have also our health system. There are gaps in our health system. There are things that we expect to be there, but they are not there. We also have a lot of awareness gap, especially in the rural areas. And sometimes it's so sad that you see a mother with a sick child, she can't even afford just a small amount of money to buy first aid thing that the child needs. Something as small as paracetamol. So it's a challenge, and I think it's good that Nigeria, the government of the land, is taking this effort through the SARMAAN project to address it. Thank you.
Okay, thank you so much. I'm happy you mentioned that again. This SARMAAN project is a federal government project. Correct me if I'm wrong. Fantastic. So that clearly shows that this is another way that government is intensifying efforts in this regard. So this has been happening, or these have been happening for over 2 decades. We are hearing that number is declining, yet reports will come, will be released, and we'll be hearing Nigeria's maternal child health mortality rates still skyrocketing. And in spite of all of these interventions, is it that these things, all the interventions, are they not working? Are they not well being implemented? We need to understand all of this. But while we look at all of that, Doctor, now my next question to you is, let's talk about this SARMAAN project itself, the project. Okay, what differentiates SARMAAN from other maternal and child health programs currently operating in Nigeria?
Yeah, thank you very much for that question. The SARMAAN project is a research project, and it's not yet a program, and is led by National Institute of Medical Research, which is part of the Federal Ministry of Health. And what it's aimed at is to show that if our children between age 1 and 59 months are given azedem as promacin, it will reduce, it will reduce mortality rate. And the hope is that after this research phase, the federal government, the state government will not take that initiative to make sure that it's a routine drug that is available for these children. Of course, you know that it's not, the SARMAAN project is presently not covering all the states.
All the states.
So presently we have, we're implementing in 11 states. Okay. And we hope that by the time the result is out and shared, the government will take the lead to now ensure that all the states benefit from this. So what is different? It is led by government. We have donor, we have implementing partners, we have people assigned, we have implementing partners implementing in different states. And how is it different? We get to all children. Our mandate is leave child behind. So wherever found, because we leverage our health system, we work with the communities. Working with the government and working with the communities. In Nigeria, we need to make sure that our communities are involved in what we are doing for them. Don't just come and give them, the commodities. They need to be aware. The SARMAAN project has different stages. For example, in Bauchi, during the kickoff, the first dose was given by the First Lady of Bauchi. So that is government commitment. And some other LGAs also, the First Ladies in those LGAs launched this activity. But the other thing is that the community directed distributors, those people were selected at the community, so they know them. Once they come, the community will start interacting with them. So they are it's community based, house to house, and then the whole health system is involved. So because we are targeting to reach all our 5 children, 1 to 9 months, so that's why it's different. And when we say this is the coverage reached, it's not just people in the town, whether it's hard to reach, everywhere. Even where we have security challenges, we talk with the government, talk with people at the leadership at that level to ensure that those children are not left out.
I do hope that the IDP camps are being reached well.
Yes, very well.
Okay, so are we also saying that because you did say that the first dose was given by First Lady of Bauchi State, you say that this intervention kicked in Bauchi because you have reached 11 states so far?
No, we have Sokoto, we have Katsina, we have Kebbi. All the states, they use different platforms. Some are implementing using the polio platform. Some are implementing using the seasonal malaria campaign. Different states. But in Bauchi particular, all the commodities were already in the different states. So she used that to let them know that the leader at the highest level have certified this is the way to go. As so as doing it in Bauchi Town, we're doing it in Katagum, in Toro, in all LGAs in Bauchi State.
All right. SARMAAN is yet to reach the southwestern part of the country, is it?
Yes. It also happened in eastern states, like Abia State, yes.
All right. Now, let's talk about how communities have been responding to SARMAAN. How have caregivers and communities responded so far towards this intervention at the grassroots levels? Because that is where usually when we or we hear of interventions of this nature, we hear that, we are actually targeting the community, the grassroots. So what have been the responses like?
Yeah, the good news is that we didn't have rejection in Bauchi. There was no rejection in the round 1 and even the second round, because we are getting ready for the round now in Bauchi. Even during that first round, because also there was awareness, different levels, the community leaders, the religious leaders, the emirs, everybody was involved in the awareness creation, way ahead of the distribution of the azithromycin. So they had opportunity to ask questions.
Okay.
What is this? Why are we taking this? And explanations we are giving to them. And that helped us to have acceptance, full acceptance of the AZM. And also, during that first round, one thing that we noticed is that a lot of children, you either see them with running nose, coughing, and of course you see those signs when you are in the field, especially in rural communities. But their mothers, the caregivers, were very happy to receive the first dose. And during the second dose, in fact, when you are in the house, they're already getting ready, getting out with their cards to make sure their children don't miss it. The acceptance rate is very high. And that's because the community were involved, their leadership they are involved, the government is also leading on this.
All right.
Thank you.
Thank you. So, any particular reason why this project SARMAAN started from the north and a part of east that you mentioned earlier? Was there any form of research that was carried out earlier before that decision was made? To say, okay, let's start this from this part of the country.
Yeah, thank you very much. Of course, I told you that is NIMA that is leading on this. And of course, we have the mortality rates across the states in Nigeria. So they look at that, and that is what decides. Because you cannot go to a particular state when the mortality rate is not as high as it is in the other. Right. So the mortality rate in all the states in Nigeria is what is driving where the intervention started from.
All right, we still have more, but at this point, I would love for Lagos to be a part of this conversation. Lagos, if you have been listening to us and you're trying to make a sense of what we've been talking about, the conversation we're having this morning is driven by a troubling, as I said earlier, new reports by United Nations, and then we have SARMAAN on the show. It is also an approach of the federal government, a form of intervention, so it doesn't sound new to you or to your ears whenever you hear as such again. Okay, so the number is to call 0201 465 719 975 805. No, once again, WhatsApp is 009 5975 805. Yes, that's where to forward your question. Somebody was calling earlier before now. Male line is 0201 277 0993. Female 0201 465 7190. So you may want to try again. Now, Dr. Olamiju, tell us, can you share a story that captures the real life difference SARMAAN is making for families, given your experience as one of the SARMAAN program implementation partner in Bauchi State?
Thank you very much.
Oh, we have a call.
As I mentioned
Dropped.
earlier,
Continue, please.
it's sad. Can you hear me?
Yes, please. We had a call that sort of distracted.
All right. So it's very sad that, when you go to the rural communities during our first round,
Mm-hmm.
virtually all the children we met had one issue or the other. Either running nose, of course, coughing, you also see that this child is struggling. And when you ask, the caregiver or the mother, what happened? It's ordinary catarrh, it's ordinary cold, it will go with. But, you begin to wonder, how long have you had this, as this child have this cough and cold? They talk about 1 week, 2 weeks, or it will go. Sometimes some of them will say it will come and go. But this second round, I tell you, there was drastic reduction in those symptoms by the time we were in the field.
Okay.
So for us, it's a good development.
All right.
And also, even the caregivers, they were telling us that they have not gone to the clinic for to be able to address such symptoms in a long while, because we had 6 months gap from the first round to the second round that was done in February.
Right.
So for us, it is a good sign, and I think government leading it, we should all support it.
All right, let's take this call. The person has been persistent. Good afternoon. Hello, Natural Info. Good afternoon. Oh, this person has been calling. Oh, okay, we have another one. Good afternoon, Natural Info 99.3. Hello. Okay, the telephone lines again. What's going on? 0201277093, We are getting calls, but we are unable to attend to them. Please keep trying, and if you are still struggling, you can forward your message to our WhatsApp 009-5975805. Tell us, why do these deaths persist despite years of interventions by the government? Also, what can be done differently to save more Nigerian children? As the conversation this afternoon is, Nigeria still leads in under 5 deaths. Can SARMAAN change the story? And of course, SARMAAN is already changing the story, and this is where you're already listening to the story, how they're handling it through this implementation. Okay, so keep trying. Now, Dr. Olamiju, let's continue with our questions while people are still trying to call into the studio. Now, my next question is, how does SARMAAN align with Nigeria's commitment to global child survival goals? Because I remember going through the research by the implementation. I'm looking for that report right now. I have it as part of my prep, but I want to be correct. The federal government released a particular document that targets this maternal mortality, especially child mortality between 2025 to 2030. Yes, that's it. So in an attempt to bring down the statistics in terms of mortality rate in Nigeria, child mortality rate in Nigeria. So how is the government, how are they warming up to this? Are they going to meet that target 2030?
Yes. All of us will have to work together to be able to achieve that. As you know, the government will not be able to do everything.
It's the social, is the, let me tell you the title of that document. Federal Ministry of Health and Social Welfare's Nigeria's Child Survival Action Plan 2025 to 2030. That's it. Yes.
So, as I mentioned earlier, the government, Federal Ministry of Health, is leading on this. And why we are saying that all hands should be on deck is because just giving the azithromycin alone will not solve the problem. we need to be all involved. The caregiver at home will need to make sure the environment is clean. Who is going to tell that caregiver that this environment, the sleep, where the child sleeps, what the child is eating, will affect their survival? That's why I'm happy that the media, you are here speaking on this. We need to be able to create more awareness. We need to be able to talk to caregivers. We need to be able to also speak. Some of them, they don't have radio. They are just cut off. They don't have, we need to be able to communicate, but they have a social group at the community level. They go to the health center. So when they go there, what kind of communication package do they use in communicating to them? Do they use the language they can understand? Because if all of us are working towards this 2030 goal that the government have set up, we have to make sure there is water, there is good sanitation. So it's not just the Federal Ministry of Health alone. We need to all work together. And that is why SARMAAN is very heavy on integration.
All right.
Let's have a consortium. Let's work together. Because all of us need to put hands together to make sure that. Thank you.
All right, Dr. Olamiju, we do have a course. Let's pick this one. I have a message to you.
Hello, good afternoon.
Good afternoon, Madam Aibe.
Yeah, this is Ahibe on the line.
Yes, please.
All that what the woman has explained is based on good diet. And the children need fruits more than adults, hence they are developing. That's how a doctor came to address us. During the pregnancy, women are asked to eat more fruits to have enough vitamin to boost the immune of the baby in the womb. So, and that's what I did. I never go to hospital with my daughter now that is 30 years. So I believe it's just environmental influence or ignorance. The Nigeria rural area, they don't eat orange, they don't eat pineapple, they don't eat cucumber, they only eat that cereal and wheat. So, and that is just to mold the baby without giving the enough vitamin to enlarge their body effectively.
Right.
For instance, in the north, because they eat a lot of granite and maishano, they have joint problems and eye problem because excessive oil do not allow the blood in the tiny veins of the eye to reach the eyeball.
All right.
That's what the doctor explained anyway.
Madam Aigbe, thank you for your contribution. Dr. Olamiju, Madam Aigbe appeared to have sounded big on nutrition, basically. So how would you respond to her submission?
Thank you. I totally agree with Madam Ahigbe. Thank you for that comment. I mentioned awareness, because even during pregnancy, there are some milestones when you are not able to meet it for the child in the womb. It's gone, no matter how you eat it afterwards. And even in the community, they have this. They have the vegetables very fresh. You have the alefo, you have the jogele leaf, you have all this. But who is telling the caregiver that this is what you need to eat? Oh, they will tell you, I don't have money. But right there at their boundary between their house, their own room and the other, there are leaves. The jogele leaf, you even sometimes when they even have fish, for those that are in the fishing community, they prefer to eat.
Okay.
We are not talking about things they will need to buy. You have the quail, you have the local fowl, the eggs.
Okay.
How much do they understand that these children actually need this to improve their nutrition? So we are just saying that all hands need to be on deck. We need to ensure that awareness on nutrition and the connection it has with child survivor needs to be need to be improved.
We do that on the show. Sometimes we do child nutrition awareness. Maybe we also need to intensify our efforts because sometimes it looks like Nigerian parents need to understand a lot in this regard and not just to giving this children quantity over quality. Okay, doctor, my last question actually because of time, because I still want to read out a message. So my last question is, what role can government and partner play in accelerating SARMAAN's reach and impact given the current record of over 15 million unique children reaching from 2024 up to now? Now, before you respond to that question, let me read this one. This one is coming from Sheyi Adedimeji. Sheyi Adedimeji says, good afternoon. It's looking like sometimes we need to sit this parents. Sometimes we need to sit we parents down and school us effectively on how to cater to our children, especially between the ages of 1 and 5. Because indeed, like Zaynab said, the statistics is disturbing. Well done, Zaynab, and many thanks to Dr. Olamiju. Sheyi Adedimeji says.
Thank you.
So, Doctor, anything to say?
Yes, very well. You know, in the next
so parents should be schooled.
Yes, the SARMAAN project is a research project. It will round up and it will be handed over to government. So we are all working together, working with the policy. That there are policies that the government of Nigeria, you've already signed to it, and we just make sure that there is a sustainability of this going forward. And we should also walk the talk. We should ensure that those policies signed up are actually worked upon.
Okay.
Then the other point you mentioned around
the impact.
Parents.
Okay.
Yes. Educating the parent is that a lot of these children, some of the parents, they just, especially those that get pregnant early pregnancy. They want to get off. Okay, I have this pregnancy and I've given birth. Let me just drop the child with. Just give birth to the child and go away and go on with my life. Early pregnancy needs to be addressed, and all the parents also need to be intentional about on the 5 mortality reduction.
Doctor, it breaks my heart to wrap up the show because even Ruth can see that we have calls. I don't know why people called at this time, though they were trying to call, but the lines were playing up the other time. But I do hope that we'll have Dr. Olamiju back on the show very soon. I would love to have you again so we can talk about these statistics and what has changed, what has improved towards meeting the 2025 to 3030 targets. Thank you so much for your time today, Dr. Francisca Olamiju, and well done on the SARMAAN project.
Thank you very much. Thank you very much. I'm grateful.
All right. Enjoy your weekend. All right. Lagos Boluwati Fair is live in the studio for the 1 o'clock news. Don't go anywhere. Please stick around.
.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info. Let's talk.